All right. Hello. So today we're doing 44 pre-next generation NCLEX UWorld questions for nursing. So as you know, the format for the NCLEX exam, licensing exam, used to be um, different to what we have now. Now we have the next generation NCLEX, but before we had the pre next generation NCLEX. And you will see it in the format of the questions. And we're going to be doing, like I said, 44 questions. And the category that I have chosen is critical care. But before we proceed to the questions, I think it's very important to review what exactly is critical care, because being a nurse doesn't mean there's only one nursing role. In fact, being a nurse actually means there are many possible nursing roles. So in order to get the answer right, one must know what exactly is going on in the situation and what is being expected of the nurse. So the setting, once again, is critical care, and critical care is a specialized medical treatment or setting for specialized medical treatment for patients with life-threatening illnesses or injuries. It usually takes place um, in an intensive care unit, in an ICU. But when you have a critical care moment, it could also be outside of an ICU. So, for instance, the patient's heart rate, you find that the the patient's heart rate is like 200 beats per minute or something. That's a critical care moment. You have to call critical care, and in some hospitals they call it outreach. But anyway, in the intensive care unit, it involves 24-hour care from a team of specially trained healthcare providers. And the treatments, they can include treating or preventing central nervous system failure, uh, treating circulatory failure, shock-like conditions, renal, hepatic, metabolic, or respiratory failure, post-operative complications. So yeah, the patient's life is really at stake or at risk. And because it is such a setting, you see various equipments to support the patient, such as catheters, dialysis machines, feeding tubes, IV tubes, machines that check vital signs, oxygen therapy, tracheostomy. Okay, let's begin. So here's question number one. Upon arrival in the post anesthesia care unit, the nurse performs the initial assessment of a client who had a surgery under general anesthesia. Which assessment finding prompts the nurse to notify the healthcare provider immediately? A. Difficult to arouse. B. Muscle stiffness. C. Pinpoint pupils. D. Temperature of 34.4 degrees. So I'll just give you 3 seconds, or you can pause the video, think about it, and then once you think you know the answer, you can, uh, I'll show you the answer. Okay, one, two, three. So the answer is actually B, muscle stiffness. And if you read the question, The patient is in a post anesthesia care unit. So the patient just had anesthesia. And the worst thing that can happen to the post-operative patient after anesthesia is malignant hyperthermia. Um, it's a rare genetic and dangerous life-threatening physiological reaction to general anesthetics. The cause is genetic abnormality of the ryanodin receptor of cells. It's the ryanodin receptor is the receptor of the cell calcium channels. So it's a metabolic problem, and one of the telling, worrying signs that the patient has developed malignant hyperthermia after anesthesia is muscle stiffness. So the cluster of signs that you should be looking for to prevent malignant hyperthermia and therefore the death of the patient is signs like increased carbon dioxide levels, muscle stiffness, hyperthermia, tachycardia, acidosis, and hyperkalemia. So that's B, muscle stiffness. Difficult to arouse suggests a damage to the brain, but there is really nothing in the question to suggest that there is a physical injury to the brain. Excessive anesthesia does lead to difficulty of breathing or nausea and vomiting. It can also be countered with oxygen therapy if it comes down to that. But it's not as dangerous as the malignant hyperthermia, given the context. Also, pinpoint pupils. That's an indication that something is medically wrong with the patient, but it does not typically immediately lead to death. So malignant hyperthermia is the priority here. And mild hypothermia, that's not going to kill the patient, or it takes a long time for it to kill the patient. So you can give the patient something warm. Also, yeah, you can give the patient something warm, like tea and blankets, sweaters. Okay, question number 2. A registered nurse is precepting a new nurse in the intensive care unit. The client is sedated with propofol on a mechanical ventilator and is receiving enteral feeding via nasogastric tube. The new nurse performs interventions to prevent aspiration. The preceptor should intervene if the new nurse performs which of the following actions? A. Assesses gastric residual volumes every 4 hours. B. Measures the number of centimeters the feeding tube is secured at the nair every 4 hours. Requests that the physician change the client from continual to bolus feedings. Or D. Uses a sedation scale to titrate down sedation. Okay, I'll give it 3 seconds. And the answer is request C. Request that the physician change the client from continual to bolus feedings. The difference between continuous feeding and bolus feeding is that bolus feeding is intermittent and continuous feeding is continuous. That means if bolus feeding is every 4 hours, then every 4 hours you give the container of the feed to the patient. And then the feeding is done within 20 to 30 minutes. Then you give them another container after 4 hours, etc., etc. In continuous feeding, the feeding pump is always running, and the feed is administered drop by drop, only interrupted by events such as medication administration or during bag and tube change, for instance. The advantage of continuous feeding is that it spreads out the infusion of the feed so that there's no danger um, of the stomach contents overflowing. into the lungs. So intermittent or bolus feeding infuses the feeds as a bolus, meaning it's a more rapid rate. And a patient who is sedated, that you it's not really safe to give them bolus feeds. Not really safe. It really isn't safe. It's not safe because the feed could overflow from the stomach into the lungs. So, assessing gastric residual volume, which is using a stethoscope to check how much fluid volume is in the stomach, is not a bad thing. Measuring the feeding tube at the nair is actually a safety check and must be done regularly. Using a sedation scale, like a scale to assess the patient's level of sedation during sedation titration, is good practice. Okay, question 3. Based on the progress note documentation, which priority intervention does the nurse anticipate? Patient has chest pain, shortness of breath. Central venous pressure is 18. Pulmonary artery wedge is 25. There are coarse crackles auscultated bilaterally. So, what is the priority intervention? A. Sodium chloride, 0.9% sodium chloride, 500 ml intravenous bolus. Furosemide, 40 mg intravenous push. Metoprolol, 5 milligram intravenous push. Vancomycin, 1 gram intravenous every 12 hours. And the answer is furosemide, 40 milligram intravenous push. So the patient has a chest pain, shortness of breath, and bilateral coarse crackles, meaning the patient is drowning in their lungs. To save the patient, the fluid from the cardiovascular system, which is seeping into the lungs, must be decreased, and this can be done with furosemide. It's the diuretic that induces the patient to urinate excess water from the body. The decrease in fluid volume will stop more fluid going to the lungs. I wouldn't be surprised if if the patient actually has congestive heart failure leading to pulmonary edema, which is what happened. So anyway, sodium chloride will actually worsen the fluid overflow in the lungs because salt draws in more water. Metoprolol is an antihypertensive that decreases the force of heart contraction, decreasing heart rate. It does not solve the fluid overflow in the lungs. Vancomycin is an antibiotic. The patient does not have an infection. Okay, question number 4. In the ICU, the nurse cares for a client who is being treated for hypotension with a continuous infusion of dopamine. Which assessment finding indicates that the infusion rate may need to be adjusted? A. Central venous pressure is 6 mm. B. Heart rate is 120 per minute. C. Mean arterial pressure is 78 millimeters. D. Systematic vascular resistance of 900 dynes. And the answer is heart rate of 120 per minute. So the dopamine increases the heart rate and the strength of the contraction. The patient's heart rate is 120. That's 10 points away from 130, which triggers critical care for adults. The continuous infusion of dopamine needs to be adjusted. It needs to be lowered to keep it away from 130. um, Normal central venous pressure is 2 to 8. Normal mean arterial pressure is 70 to 105. And normal vascular resistance is 800 to 1200. Okay, fifth question. The nurse is caring for a client who had a near drowning accident in cold weather. Which assessment finding indicates the most severe injury? A. Decreased body temperature. B. Toes point straight down. C. Weak and thready pulse. D. Wheezing on auscultation. And the answer is B. Toes point straight down. And the reason is toes pointing downward is a sign of traumatic brain injury to the middle and lower part of the brain. It is most likely the case that there is intracranial bleeding, which is causing brain herniation, which is producing uh, these signs, the toes pointing down sign. It is actually a sign that the patient is approaching death. So the decreased body temperature, weak and thready pulse, and wheezing on auscultation are all expected due to the near drowning in cold weather. Exposure to cold causes decreased body temperature. Severe hypothermia can lower the heart rate below 60 beats per minute. The wheezing is from water from the lungs. These are not as severe as the brain injury, which is indicated by the toes pointing down. Okay, next question. A client with blunt trauma undergoes an exploratory laparotomy to repair the intra-abdominal injury. After 24 hours, the client has an NG tube attached to continual low suction, 2 Hemovac closed wound suction abdominal drains, and is receiving IV Ringer's lactate and continual epidural morphine. The client now develops hypotension, tachycardia, oliguria, and severe nausea. What is the client's priority nursing diagnosis at this time? The answer is A, deficient fluid volume. Trauma with intra-abdominal injury, meaning damage to internal organs, can mean internal bleeding. The hypotension, tachycardia, and oliguria confirm bleeding, actually, or blood loss leading to fluid volume insufficiency in the cardiovascular system. So, because of the bleeding, there's been a lot of loss of fluid volume that's captured in the hypotension. The cardiovascular system tries to compensate, so there's an increase in the heart rate, and because of the loss of the fluid, it's also difficult for the patient to have anything to urinate. That's where the oliguria comes from. So this is there is deficient fluid volume despite the IV Ringer's lactate. So the patient will need more IV fluid infusion as a consequence. Impaired urinary elimination is secondary to the hypovolemia. Nausea is caused by the morphine. Risk for infection is not the most urgent issue. Okay, question number 7. A client with hypothermia has just arrived in the emergency department via ambulance. The client is being warmed with blankets, and IV fluids are being changed over to warm fluids. What additional intervention is a priority? A. Attaching the cardiac monitor. B. Covering the client's head. C. Drawing blood for electrolytes and glucose. D. Placing an additional large bore IV catheter. The answer is attaching the cardiac monitor. So there are two priority interventions for hypothermia. The first one is rewarming. The other is monitoring the patient's heart rate. This is because hypothermia can actually lead to dysrhythmia, and which could potentially kill the patient. That's why the patient needs to be attached to the cardiac monitor. Covering the client's head helps to rewarm, but it does not monitor the patient's heart. Hypothermia can lead to abnormal electrolyte and glucose levels. However, monitoring the heart is the priority. The question does not indicate a need to deliver IV fluids at a faster rate or need to ensure IV access. There is no need for an additional large bore IV catheter. Question 8. The intensive care nurse is caring for a client who has just been extubated. Which interventions are appropriate at this time? Select all that apply. A. Administer prescribed oral narcotics for throat pain. B. Administer warmed humidified oxygen via face mask. C. Give the client ice chips to moisten the mouth. D. Provide mouth care with oral sponges. E. Start the client on incentive spirometer. And the answer is, it's a select all question, by the way. The answers are B. Administer warm humidified oxygen via face mask. D. Provide mouth care with oral sponges. And E. Start the client on incentive spirometer. So, extubation is the removal of an intubation tube, like an endotracheal tube, a tube inserted nasally or orally into the trachea to ensure airway patency. Um, a reason why the patient is being extubated can be that the airway patency is no longer threatened or no longer an issue, so the patient can now use a face mask instead. So the the question says the patient has just been extubated. So what now? After extubation, the patient needs mouth care for comfort. Um, that's where the oral sponges come in. The patient needs to be transitioned to less invasive oxygen therapy. So that's the face mask. The setting is an ICU, so if the patient needed to be intubated in the first place, then the patient is being switched to less invasive oxygen therapy. The client is started on incentive spirometer as well to train the patient's lungs for breathing and expand the alveoli. This prepares the lungs. So oral sponges are used to clean the mouth and prevent dryness. Then the mask is administered, and the patient gets started on the incentive spirometer. So ice chips are not used to moisten the mouth. Wet sponges are used for moistening the mouth. Um, a patient who was just extubated could have been swallowing issues, and thus administering medications orally at this time is unsafe. They need their swallowing evaluated first. So question 9, a client with massive trauma and spinal cord injury is admitted to the emergency department following a motorcycle collision. Which assessment finding leads the nurse to suspect neurogenic shock? An apical heart rate of 48 per minute, blood pressure of 186 over 92, cool clammy skin, or D, temperature of 100 Fahrenheit. And the answer is an apical heart rate of 48. So, neurogenic shock is caused by a disruption to the autonomic nervous system, affecting the cardiovascular system, and bradycardia is a sign of neurogenic shock. A disruption to the autonomic nervous system concerning the cardiovascular system leads to a weakening, not a strengthening of blood pressure due to the loss of blood vessel tone and reduction of heart rate. So it cannot be blood pressure of 186 over 92. Cool, clammy skin can be a sign of disruption in the autonomic nervous system, but it does not necessarily mean that there is neurogenic shock. We need information about the cardiovascular system to diagnose neurogenic shock. Temperature of 100 degrees Fahrenheit is a fever. Um, Disruption to the autonomic nervous system leads to cooling of the body, not warming. Question number 10. A nurse in the intensive care unit is caring for a client with sepsis who is on a mechanical ventilator. The client is exposed to the noise of the mechanical ventilator, monitoring equipment, and the infusion pump alarms during the day and night. What should the nurse identify as the priority nursing diagnosis? A. Anxiety. B. Disturbed sleep pattern. C. Powerlessness. Or D. Risk for acute confusion. And the answer is disturbed sleep pattern. This is because the noise of the mechanical ventilator, monitoring equipment, and infusion pumps will disturb the patient's sleep pattern. We can give the patient sleeping aid or find a way to lower the noise. It is not anxiety because there is nothing in the question that says the patient is anxious or will have anxiety. There is nothing we can do medically about the patient's feelings of powerlessness. There is nothing in the question that says the patient is confused or will become confused. Okay. All right, question 11. A client who is 2 hours post aortic valve replacement is in the ICU. The low pressure alarm for the client's radial arterial line sounds. Which action should the nurse take first? A. Check for bleeding at tube connection sites. B. Perform a fast flush of the arterial line system. C. Re-level the transducer to the phlebostatic axis. D, zero and rebalance the monitor and system. And the answer is A. Um, the low pressure alarm for a radial arterial line means hypotension or low pressure at the radial arterial line. The most likely explanation for the hypotension or low pressure is loss or leak of blood. Therefore, the nurse should check the tube connection sites for bleeding, leak. Before performing an intervention, the nurse must first figure out what is going on. So, performing a fast flush of the arterial line, that's the nursing process, by the way. First, you need to have an idea of what's going on, evidence-based, before you perform an intervention. So, performing a fast flush of the arterial line system, releveling the transducer to the phlebostatic access, and zero and rebalance the monitor and system do not assess the situation. An assessment is needed first. These options are straightaway interventions that may or may not address the problem, and most likely they will not. So the assessment is A. Check for bleeding at tube connection sites. Question 12. A nurse in the emergency department is caring for a homeless client just brought in with frostbite to the fingers and toes. The client is experiencing numbness and assessment shows mottled skin. Which interventions should be included in the client's plan of care? Select all that apply. A. Apply occlusive dressings after rewarming. B. Elevate affected extremities after rewarming. C. Manage the areas to increase circulation. D. Provide adequate analgesia. Or E. Provide continuous warm water soaks. And the answers are B. Elevate affected extremities after rewarming. D. Provide adequate analgesia. And E. Provide continuous warm water soaks. So frostbite causes vasoconstriction and hypoxia of frostbitten tissues. Warm water soaks and end the vasoconstriction and consequently the hypoxia. Damaged tissues become edematous, which impedes circulation and perfusion. The affected extremities must be elevated to use gravity to drain the edema and assist with the circulation. Frostbitten parts are damaged and are thus in pain. Therefore, analgesia should be provided. Occlusive dressing is for wounds. The patient has no wounds. Um, Open wound. uh, Massaging frostbitten tissue further damages the tissue, so don't massage frostbitten tissue. It increases damage to the tissue. Question 13. The nurse is caring for a client who is 1 day post-operative extensive abdominal surgery for ovarian cancer. The client is receiving IV Ringer's lactate at 100 ml per hour and continual epidural morphine for pain control. The Foley catheter urine output has decreased to less than 20 ml per hour over the past 2 hours. The post-operative hematocrit is 36% and hemoglobin is 12 G per L. Which action should a nurse carry out first? A. Assess the vital signs. B. Increase the IV rate to 125. C. Notify the healthcare provider. Or D. Perform a bladder scan. And the answer is A. Assess vital signs. Before performing an intervention, and this is nursing process by the way, there must be an assessment. Therefore, the vital signs must be taken. Besides, the decreased urine output could be caused by hypovolemia or an issue with the patient's urinary system itself, or a neurogenic bladder. To know which problem it is, a blood pressure read is required. Performing a bladder scan is the step after taking vital signs assessment if the blood pressure is normal. Increasing the IV rate is an intervention without knowing what is the problem with the patient. Notifying the healthcare provider to say what. The healthcare provider will tell you to take a vital signs assessment, which should have been done first. Question 14. The nurse caring for a client with pulmonary edema responds to the mechanical ventilator high pressure alarm. The nurse would assess for which conditions that can trigger the high pressure alarm. Select all that apply. A. Biting in the tracheal tube. B. Disconnected ventilator tubing. C. Endotracheal tube cuff leaf. D. Excessive airway secretions. E. Kinked ventilator tubing. And the answers are A. Biting in the tracheal tube. D. Excessive airway secretions. And E. Kinked ventilator tubing. The mechanical ventilator measures the airway pressure in the lungs and in its delivery tubes. Highway pressure alarm means something has happened to the patient's respiratory system or the delivery tubes to increase the pressure to high. The patient could be biting the endotracheal tube. There could be a kink in the ventilator tubing, or the patient could be having excessive airway secretions. A disconnected ventilator tubing or an endotracheal tube cuff leak will actually decrease the pressure, triggering the low pressure alarm, not high pressure alarm. Question 15. A client is admitted to the intensive care unit with diabetic ketoacidosis. The client is most likely to exhibit which of the following arterial gas results? So check A, the pH, the CO2, and the bicarbonate, the HCO3. And which one do you think means the diabetic ketoacidosis? And the answer is B. pH of 7.3, PaCO2 of 30, and bicarbonate of 15. So diabetic ketoacidosis is an acidosis, so the pH must be acidic. The pH of 7.3 is acidic. Diabetic ketoacidosis is also a metabolic acidosis, not respiratory acidosis. Therefore, um, Oh, yeah. So the bicarbonate is metabolic, and the bicarbonate is 15, which is acidic. So it's B. A is pH acidic, but the bicarbonate is normal. C is pH normal. D is pH basic. Question 16. The emergency department nurse receives a client with extensive injuries to the head and the upper back. The nurse will perform what action to allow the best visualization of the airway? Option A, head tilt chin lift in the supine position on a backboard. B, head tilt chin lift in the Trendelenburg position. C, jaw thrust maneuver in semi-Fowler's up position. D, jaw thrust maneuver in the supine position on the backboard. And the answer is D, jaw thrust maneuver in the supine position on a backboard. So to visualize the airway, the patient must be flat on his back, that is supine position. And to open the patient's mouth, use jaw thrust. And jaw thrust is better at stabilizing the patient's spine compared to head tilt chin lift. So when it's a choice between jaw thrust and head tilt chin lift, it has to be jaw thrust. Trendelenburg and semi-Fowlers are the wrong body positions for the patient uh, for airway visualization. Head tilt chin lift lifts the chin, making the head shaky and movable. That is not well stabilized for the visualization. Question 17. A client undergoing endotracheal intubation received IV sedation and succinylcholine. Shortly after respiratory status has been stabilized, the client becomes flushed and profusely diaphoretic and has a rigid jaw. Which medication should the nurse prepare to administer? So the temperature is 40.6 degrees centigrade, blood pressure of 140 over 90, heart rate of 150, respiratory rate of 28, and SpO2 of 98%. Option A is intramuscular injection of epinephrine. B is IV atropine. C is IV dantrolene. And D is IV glucagon. The answer is dantrolene. So succinylcholine is a muscle relaxant that can trigger malignant hyperthermia. So it's not just anesthetics that can trigger malignant hyperthermia. It's also succinylcholine that is a muscle relaxant. So rigid jaw, fever, severe tachycardia are signs of malignant hyperthermia, and dantrolene is the treatment for malignant hyperthermia. Epinephrine is for allergic reactions. Atropine is for nerve agent poisoning, and glucagon is for hypoglycemia. Question 18. The charge nurse response of a cardiac arrest with resuscitation in progress of an adult client Which of the following actions by a resuscitation team member would cause the charge nurse to intervene? Select all that apply. A. Chest compressions are performed at a rate of 70 to 80 per minute. B. Chest compressions are stopped at a 10-second point pulse check every 2 minutes. C. Defibrillator pads are applied at the left and right sternal borders. D. Manual breaths are delivered at a rate of 2 breaths per 30 compressions. E. Resuscitation team is alerted to remain clear of client before defibrillation. And the answers are chest compressions are performed at a rate of 70 to 80 per minute, and defibrillator pads are applied at the left and right sternal borders. So chest compressions are performed at 100 per minute, at a rate of 100 per minute, which is the upper bound of normal adult breathing rate. Defibrillator pads are placed on the right upper chest and the left lateral chest. B, D, and E are correct. They should actually be done. Question 19. The emergency department nurse is caring for a client who requires gastric lavage for a drug overdose. Which action would be appropriate? A. Lavage through a small bore NG tube. B. Place client in Trendelenburg position during lavage. C. Prepare intubation and suction supplies at the bedside. Or D. Wait an hour after gastric decompression to initiate lavage. And the answer is C. Prepare intubation and suction supplies at the bedside. So gastric lavage is pumping out the contents of the stomach following an overdose. There must be intubation to protect the airway and the lungs from aspiration. Lavage is done with a large bore NG tube with the patient's head elevated, not in Trendelenburg. The gastric lavage must be performed within 1 hour of the overdose. The gastric lavage cannot wait an hour. It is to be done within an hour. Question 20. A client with palpitations is admitted with supraventricular tachycardia. The client's heart rate is 210 per minute, which is the most appropriate initial intervention. A. Ask the client to bear down as if having a bowel movement. B. Grab the crash cart and apply hands-free defibrillation pads. C. Place ECG leads on client to further assess electrical activity. D. Place IV line distally from the heart for adenosine administration. And the answer is A. Ask the client to bear down as if having a bowel movement. There is actually a non-chemical and non-invasive way to reduce the heart rate during supraventricular tachycardia, and that is the patient must be asked to perform a Valsalva maneuver. A Valsalva maneuver is when the patient bears down as if having a bowel movement, and this increases the intrathoracic pressure, which stimulates the vagus nerve. The stimulation of the vagus nerve will send a signal to the heart to slow down the heart rate. We know from the question that the patient has supraventricular tachycardia with a heart rate of 210 per minute. We have a finding and a diagnosis. The only answer now requires an intervention to lower the heart rate. Applying defibrillation pads and placing an ECG to assess electrical activity are not interventions to lower the heart rate. Adenosine will reduce the heart rate. However, placing the IV line distally is wrong. It should be proximally. Question 21. An emergency department nurse is sent to the scene of a massive motor vehicle collision. A client there reports neck pain. Which actions should the nurse perform at this time? Select all that apply. A. Apply a hard cervical collar. B. Assess neck range of motion. C. Inspect client's respiratory pattern. D. Position client flat on the firm surface. E. Use lug rolling technique if moving the client. And the answers are A. Apply a hard cervical collar. B. Inspect client's respiratory pattern. D. Position client flat on a firm surface. And E. Use lug rolling technique if moving the client. It's a self-explanatory question. The patient was in a motor vehicle collision, reporting neck pain. The neck pain suggests injury to the neck, and with it the neck bones, the spinal cord, and neck tissues. The patient's respiratory pattern must be assessed because the neck injury may have also damaged the patient's neurological ability to respirate. The patient's neck must be protected, stabilized, and immobilized. That's where the collar comes in. The patient is positioned flat on a firm surface, and a rug rolling technique is used to move the patient. Assessing neck range of motion is inappropriate as it could worsen the neck injury. Question 22. Which nursing interventions are appropriate for managing the care of a client receiving mechanical ventilation and continuous IV sedation? Select all that apply. A. Maintain the head of the bed at 30 to 45 degrees. B. Mute ventilator alarms at night to allow the client to rest. C. Pause sedation daily to assess weaning readiness. D. Perform oral care with chlorhexidine solution. E. Place a manual resuscitation bag at the bedside. And the answers are A. Maintain the head of the bed at 30 to 45 degrees. C. Pause sedation daily to address weaning readiness. D. Perform oral care with chlorhexidine solution. And E. Place a manual resuscitation bag at the bedside. The head of the bed is usually not always maintained. Not usually always maintained at 30 to 45 degrees to improve the airflow. No, it usually is maintained at 30 to improve airflow. Sorry, there was a mistype. And reduce the risk because that helps to reduce the risk of aspiration. Having a resuscitation bag at bedside is for patient safety. Oral care is performed with chlorhexidine solution, and sedation is paused daily to address readiness for weaning. Muting the ventilator alarms or any alarms, even though the intention is nice, um, is a safety risk. The ventilator alarms are for safety, so if you mute the alarms, it's a safety risk. Alarm is there for the patient's safety. Never turn off an alarm, and if you do, turn it back on as soon as possible. Question 23. The nurse is caring for a client on a mechanical ventilator. The settings on the ventilator have been changed, and the standing prescription is to draw arterial blood gases 30 minutes after a ventilator change. In anticipation of this blood draw, what intervention should the nurse implement? A. Avoid suctioning the client. B. Pre-oxygenate the client. C. Raise the head of the bed. D. Reduce the amount of sedation medication. And the answer is A. Avoid suctioning the client. After the settings of a ventilator are changed, arterial blood gases are drawn to evaluate the effectiveness of the new ventilator settings. Therefore, the patient's arterial blood gases must not be disturbed. Avoid suctioning the patient so that the blood gases are not tampered with. So the results can be compared to the previous result. Pre-oxygenating the patient, raising the head of the bed, and reducing the amount of sedation medication. These all disturb the arterial blood gases or has the potential to disturb the arterial blood gases. So they cannot be done. Question 24. The flight nurse assesses an alert and oriented client at an industrial accident scene who was impaled in the abdomen by a pair of scissors. Ouch. Which nursing action is the immediate priority? A. Insert a large bore IV line and infuse normal saline. B. Obtain blood type for type and cross-match and hemoglobin. C. Remove constrictive clothing to enhance circulation. D. Stabilize the scissors with sterile bulky dressings. And the answer is stabilize the scissors with sterile bulky dressings. Objects that impale must be stabilized to contain blood flow and prevent further damage to the impalement site. The impaling object can only be removed by a specialist, such as doctors in a hospital. Attempts to remove the impaling object will lead to more bleeding and more damage. This is the immediate priority because it prevents more damage. Inserting a large bore IV line containing blood for type and cross-match and removing constrictive clothing can come after preventing more damage. Question 25. The nurse is caring for a ventilator dependent client with a neuromuscular degenerative disease and observes the plethysmograph waveform in the image below. What is the nurse's immediate action? A. Assess level of consciousness, skin temperature, and color. B. Disconnect pulse oximeter device from the client and restart it. C. Pre-oxygenate with 100% oxygen and perform endotracheal suction. Or D. Reset the high and low alarm parameters on the pulse oximeter device. And the answer is A. Assess level of consciousness, skin temperature, and color. After seeing a plethysmograph waveform, such as above, where the SpO2 fluctuates above and below 94%, The nurse would want to know if the patient is in fact getting sufficient oxygen. So the nurse would assess for level of consciousness, skin temperature, and color. Disconnecting the pulse oximeter and restarting it means you think it's a device. That's the issue. Pre-oxygenating with 100% oxygen and performing endotracheal suction is an intervention, but an assessment has not taken place. The high and low alarm parameters on the pulse oximeter device is not the priority. The priority is whether or not the patient is receiving sufficient oxygen. Question 26. The nurse is caring for a client experiencing acute asthma exacerbation. Based on the laboratory values, which acid-base imbalance is occurring? So the pH is 7.49, CO2 of 30, SpO2 of 79, and the bicarbonate is 23. Is it A, metabolic acidosis, B, metabolic alkalosis, C, respiratory acidosis, or D, respiratory alkalosis? And the answer is respiratory alkalosis. A pH of 7.49 is alkalosis. It's basic. Um, Bicarbonate of 23 is within the normal range. CO2 of 30 is above the normal range. SpO2 of 79 is below the normal range. Therefore, the problem is respiratory rather than metabolic. It is an alkalosis of respiratory nature, respiratory alkalosis. 27. The student nurse observes the respiratory therapist preparing to draw an arterial blood gas from the radial artery. The respiratory therapist performs the Allen's test, and the student asks why this test is performed before blood sample is drawn. Which statement made by the respiratory therapist is most accurate? A. The Allen's test is done to determine if capillary refill is adequate. B. The Allen's test is done to determine if the radial pulse is palpable. C. The Allen's test is done to determine the patency of the ulnar artery. D. The Allen's test is done to determine the presence of neurologic deficit. And the answer is C. The Allen's test is done to determine the patency of the ulnar artery. It's about the patency of the ulnar artery. Question 28. The nurse cares for an intubated client on a mechanical ventilation with worsening cerebral edema from increased intracranial pressure. Which nursing interventions help reduce intracranial pressure? Select all that apply. A. Clustering as many interventions as possible when providing care. B. Hyperventilating before suctioning. C. Maintaining a quiet, dark environment. D. Maintaining the head in a neutral midline position. E. Suctioning for 30 seconds to remove endotracheal tube secretions at regular intervals. And the answers are B. Hyperventilating before suctioning. C. Maintaining a quiet, dark environment. D. Maintaining the head in a neutral midline position. So worsening cerebral edema from increased intracranial pressure can kill a patient. Fluid is leaking from the blood vessels inside the head, and the increase in the intracranial pressure will cause brain herniation. What interventions or what can we do to reduce the intracranial pressure? Well, first of all, hyperventilation induces vasoconstriction. When the blood vessels vasoconstrict, they release less or stop releasing fluids outside into the interstitial space. That helps to reduce the intracranial pressure. A quiet, dark room makes the patient more relaxed, and that reduces the intracranial pressure. The neutral midline position is a head position that helps to reduce the intracranial pressure. It's where the head of the bed is 30 degrees. The head is facing midline. The neck is in a neutral position. That's the neutral midline position. The head of the bed is 30 degrees, the head is facing midline, and the neck is neutral position. So clustering interventions actually increases the stress of the patient, which increases the intracranial pressure. And suctioning is only 10 seconds long because long suctions increase intracranial pressure. Question 29. The nurse is assisting with cardiopulmonary resuscitation of a client in cardiac arrest. The rhythm in the exhibit is displayed on the cardiac monitor. Which medication administration should a nurse anticipate? A. Adenosine IV, B. Dopamine, C. Magnesium IV, or D. Metoprolol. What do you expect to give the patient? And the answer is magnesium. Um, the pattern, the rhythm, is actually a type of arrhythmia called torsade de pointe. It's caused by magnesium deficiency. So to treat it, the patient must receive magnesium. Question 30. A 2-year-old at an outpatient clinic stops breathing and does not have a pulse. A 2-year-old at an outpatient clinic stops breathing and does not have a pulse. CPR is initiated when the automated external defibrillator arrives. The nurse notes that it has only adult AED pads. What is the appropriate action at this time? A. Continue CPR without using automated external defibrillator until paramedics arrive. B. Place one AED pad on the chest and the other on the back. C. Place one AED pad on the upper right chest and the other on the lower left side. D. Place one AED pad on the upper right chest and dispose of the other. And the answer is B. One at the front on the chest and the other on the back. It does not really matter if the pads are for adults. What needs to happen is one AED pad is on the chest and the other one on the back for patients 8 years old and below. Question 31. The nurse is supervising a graduate nurse on a telemetry unit. Assigned client develops asystole with no pulse, and emergency care interventions are initiated. Which action by the GN would cause the supervising nurse to intervene? A. Administers IV epinephrine. B. Applies oxygen with bag mask. C. Initiates chest compressions. Or D. Provides defibrillator shock. Which action would cause the GN to would cause the supervising nurse to intervene? The answer is provides defibrillator shock. Asystole with no pulse means the ECG is showing a flat line. And it's a flat line because the heart no longer has any electrical activity. A defibrillator shock is for resetting electrical activity of the heart. If the heart is asystole, defibrillator is not indicated. It's a non-shockable rhythm. Administering IV epinephrine, applying oxygen with bag valve mask, and initiating chest compressions are interventions for asystole. Question 32. The student nurse and the registered nurse are caring for a mechanically ventilated client with an acute lung injury. Which statement by the student indicates a need for further education? A. I will auscultate the neck to assess for endotracheal cuff leaks. B. I will perform endotracheal suctioning routinely after oral care. C. I will provide oral care and oral suctioning every 2 hours. D. I will reposition the client from side to side at least every 2 hours. And the answer is B. I will perform endotracheal suctioning routinely after oral care. Performing endotracheal suctioning routinely after oral care is too much. It means every time oral care is provided, endotracheal suctioning is provided afterwards. Endotracheal suctioning is done as per order and as per PRN, not every time there was oral care. So that would indicate further education. Auscultating to assess for endotracheal cuff leaks is good for patient safety. Repositioning the client every 2 hours is best practice. Providing oral care and oral suctioning every 2 hours is an expected order for patients in the ICU on mechanical ventilation for an acute lung injury. Question 33. The charge nurse is evaluating the skills of graduate nurses who are caring for clients with shock. Which action taken by a GN indicates a need for further education? A. Administers furosemide to a client with elevated pulmonary artery wedge pressure and cardiogenic shock. B. Applies an SpO2 sensor to the forehead of a client with septic shock rather than using a finger. C. Raises the head of the bed to high Fowler position for a client with hypovolemic shock. D. Titrates norepinephrine infusion to maintain mean arterial pressure greater than 65 mm in a client with anaphylactic shock. The answer is C. Raises the head of the bed to high Fowler position for a client with hypovolemic shock. In hypovolemic shock, the circulatory system has lost fluid volume. This makes it difficult to pump blood throughout the body. Raising the bed to high Fowler's, which is greater than 30 degrees head of the bed, will create a situation where gravity will make it even harder to pump blood into the head. This creates a risk for brain hypoxia. In cardiogenic shock, the heart has become weak, causing a drop in blood pressure. The elevated artery wedge pressure is caused by the heart's inability to adequately push blood through the pulmonary artery. Furosemide will reduce the fluid volume in the system, making it easier for the heart to pump blood from the heart to the rest of the body. Applying the SpO2 sensor to the forehead will provide a more accurate reading of tissue perfusion. In anaphylactic shock, the anaphylaxis causes vasodilation throughout the body, leading to shock. Norepinephrine counters it with vasoconstriction. Question 44. The client is brought to the emergency department after falling off a roof and landing on his back. A T1 spinal fracture is diagnosed. The client's blood pressure is 74/40. Pulse is 50 and the client is pink and dry. What nursing action is a priority? A. Administer IV normal saline. B. Determine if urinary occult blood is present. C. Perform a neurological assessment. D. Verify that there is no stool impaction. And the question is A. Administer IV normal saline. See, the patient's blood pressure is below 80 for systolic blood pressure. This creates a perfusion issue throughout the body. Addressing this with IV normal saline is the priority action. This is because this is a case of neurogenic shock. Damage to the nervous system has led to impaired innervation of the cardiovascular system, leading to hypotension. It is already known that the SBP is below 80, and that needs to be addressed first. There are two types of neurological assessment. One is head injury, and the other is spinal cord. Based on the question, there is no bleeding in the brain. The neurological assessment is not the priority given the question. Gastrointestinal and urinary systems are not the priority here either. Question 35. The nurse is admitting a client with a possible diagnosis of Guillain-Barré syndrome. When collecting data to develop a plan of care for the client, the nurse should give priority to which of the following items? A. Orthostatic blood pressure changes. B. Presence of absence of knee reflexes. C. Pupil size and reaction to light. D. Rate and depth of respirations. And the answer is rate and depth of respirations. Guillain-Barré syndrome is a neurological dysfunction of musculoskeletal muscle control. It causes paralysis and absence of reflexes. The worst case scenario is that it prevents the patient from breathing. paralysis of the respiratory area muscles, let's just say. Therefore, the rate and depth of respirations must be assessed as a priority. '36. The nurse is preparing to defibrillate a client who suddenly went into ventricular fibrillation. Which steps are essential prior to delivering a shock? Okay, so that's question 36. Then the nurse is preparing to defibrillate a client who suddenly went into ventricular fibrillation. Which steps are essential prior to delivering a shock? Select all that apply. A. Apply defibrillator pads. B. Call out and look around to ensure that everyone is all clear. C. Continue chest compressions until ready to deliver a shock. D. Ensure adequate IV sedation has been given. And E. Ensure that the synchronization button is turned on. And the answers are A. Apply defibrillator pads. B. Call out and look around to ensure that everyone is all clear. And C. Continue chest compressions until ready to deliver a shock. Prior to delivering a shock, defibrillator pads need to be applied. You need to call out and look around to ensure that everyone is all clear, and chest compressions must be continued until ready to deliver a shock. So ensuring adequate IV sedation is not part of the essential steps prior to delivering a shock, and the synchronization button activates synchronized cardioversion, which resets an abnormal heart rhythm. It is not always used for ventricular fibrillation. Question 37. The nurse observes a nursing student performing chest compressions on an adult client. Which technique indicates that the student understands how to provide high quality chest compressions during cardiopulmonary resuscitation? A. Compressing the chest to a depth of at least 2 inches. B. Pausing after each set of 15 compressions to allow 2 rescue breaths. C. Placing the heel of the hand of the upper part of the... So yeah, A. Compressing the chest to a depth of at least 2 inches. B. Pausing after each set of 15 compressions to allow for 2 rescue breaths. C. Placing the heel of the hand on the upper part of the client's sternum. D. Providing compressions at a rate of 80 to 100. And the answer is A. Compressing the chest to a depth of at least 15 inches. It's not 15 compressions for and then 2 rescue breaths. It's 30 compressions, then 2 rescue breaths. The heel of the hand is placed on the lower part of the client's sternum, not the upper part. Compressions are to be at a rate of at least 100, not 80 to 100. Question 38. An intoxicated client not wearing a seatbelt drives into a metal barricade near the entrance to the emergency department. The client's head has hit the windshield and the client is unconscious. Conscious. What nurse actions are appropriate? Select all that apply. A. Assess the client for a carotid pulse. B. Determine the client's Glasgow Coma Scale score. C. Maintain airway with head tilt chin lift maneuver. D. Place a hard cervical collar on the client. E. Remove the client from the car onto a blackboard. And the answers are A. Assess the client for a carotid pulse. B. Determine the client's Glasgow Coma Scale score. D. Place a hard cervical collar on the client. And E. Remove the client from the car onto a backboard. So the carotid pulse is the best arterial pulse for palpation. The GCS must be assessed because we want to know the damage it has on the neurologically. A hard cervical collar will stabilize the neck and prevent further injury to the spinal cord. The backboard stabilizes the spinal column of the patient, preventing further spinal cord damage. So the head tilt chin lift maneuver is not appropriate for a patient with a neck injury because it involves the neck too much movement of the neck. Uh, the jaw thrust maneuver is safer for maintaining airway when the patient is suspected of cervical spine injury. Question 39. The nurse is caring for a client who was just resuscitated following an out-of-hospital cardiac arrest. The client does not follow commands and remains comatose. What intervention does the nurse anticipate being added to the client's plan of care? A. Assisting the healthcare provider in discussing a do not resuscitate order with the family. B. Obtaining equipment and cold fluids for induction of therapeutic hypothermia. C. Placing a small bore NG feeding tube for internal nutrition. D. Planning for passive range of motion exercises to prevent contractures. And the answer is B. Obtaining equipment and cold fluids for induction of therapeutic hypothermia. And the reason is a client who does not follow commands and remains comatose is indicative of neurological injury. Therapeutic hypothermia improves neurological recovery, and it is used after cardiac arrest that led to neurological injury. The NR order NG2 for internal nutrition and passive range of motion exercises do not address the patient's health needs, immediate health needs pertaining to the cardiac arrest and neurological injury. Question 40. A nurse is caring for an intubated client receiving a continuous sedative infusion. Which interventions by the nurse reflect correct understanding of preventing ventilator-acquired pneumonia? Select all that apply. A. Elevating the head of the bed 30 to 45 degrees. B. Performing hourly inline endotracheal suctioning. C. Practicing strict hand hygiene. D. Providing frequent oral care with chlorhexidine. E. Scheduling daily sedation vacations. And the answers are elevating the head of the bed 30 to 45 degrees, practicing strict hand hygiene, providing frequent oral care with the chlorhexidine, and scheduling daily sedation vacations. Elevating the head of the bed to 30 to 45 degrees prevents aspiration, and aspiration leads to pneumonia. Daily sedation vacations allow for assessment of appropriateness of the intubation. because intubation increases the risk of pneumonia. So the sooner the patient is off intubation, the the sooner the risk for pneumonia is removed. Um, Also, getting the patient off the ventilator reduces the development of ventilator-acquired pneumonia. Practicing strict hand hygiene prevents infections. Providing frequent oral care with chlorhexidine prevents infections. Um, because chlorhexidine is an antiseptic and disinfectant. Performing excessive endotracheal suctioning will increase the likelihood of infection. Question 41. The nurse is caring for a client receiving mechanical ventilation. The ventilator begins alarming and displays an alert about low tidal volumes. The nurse checks the endotracheal tube and ventilator tube and the ventilator tubing, but does not find any obvious cause of the alarm. The client's oxygen saturation is decreasing. What should the nurse do next? A. Call a respiratory therapist to the bedside to troubleshoot the ventilator. B. Elevate the head of the bed and apply a non-rebreather mask. C. Increase the oxygen delivery setting on the ventilator to 100. Manually ventilate with a bag valve mask resuscitator attached to the endotracheal tube. And the answer is D. Manually ventilate with a bag valve mask resuscitator attached to the endotracheal tube. The client's oxygen saturation is decreasing and cannot find the cause of the ventilator alarming and displaying low tidal volumes. The nurse cannot do anything about the mechanical ventilation, but the nurse can do something about the client's decreasing oxygen saturation. The first thing the nurse needs to do is to ventilate with a bag valve mask that is attached to the endotracheal tube. Afterwards, the nurse needs to call the respiratory therapist or have someone call the respiratory therapist to troubleshoot the ventilator and adjust the oxygen delivery system on the ventilator if that is needed. It does not make sense to apply a non-rebreather mask on the client because the client is on an endotracheal tube. Oxygenating the client requires the bag valve mask. Question 42. The nurse is caring for an intubated client whose oxygen saturation begins to drop. What action should the nurse take first? A. Auscultate lung sounds bilaterally. B. Hyperoxygenate with 100% oxygen. C. Manually ventilate with bag valve mask. D. Suction the endotracheal tube. And the answer is auscultate lung sounds bilaterally. Once again, before pursuing an intervention, an assessment must be performed so that the nurse can determine the appropriate intervention, that is the nursing process. Hyperoxygenating with 100% oxygen, manually ventilating with bag valve mask, and suctioning the endotracheal tube are interventions. So, assessment first, then intervention, if the question doesn't already tell you what's wrong. Question 43. A client with acute respiratory distress syndrome is receiving positive pressure mechanical ventilation with 15 centimeter H2O positive end expiratory pressure. The nurse should assess for which complication associated with PEEP. A. Barotrauma. B. Decreased oxygen saturation. C. Hypertension. D. Oxygen toxicity. And the answer is barotrauma. Barotrauma is the physical damage caused by the pressure inside the lungs and pressure in the alveoli. High levels of positive and expiratory pressure can rupture the alveoli. So that's the barotrauma. And the final question, question 44. The nurse precepts a new nurse caring for a client showing signs of improvement from hypovolemic shock. Which action by the new nurse would cause the preceptor to intervene immediately? Vitals are temperature 36.8, blood pressure 103/55, heart rate 91, respiratory rate 18, SpO2 99. A changes the oxygen mass to a nasal cannula. B, delays requesting a new norepinephrine IV bag when the first is almost finished. C, postpones giving IV antibiotics due to inadequate IV access. D, questions prescription to change IV fluids from 0.9 to 0.45 normal saline. And the answer is B, delays requesting a new norepinephrine IV bag when the first is almost finished. So, norepinephrine is a vasoconstrictor to help support the blood pressure. The patient's blood pressure is not quite normal yet. Um, well, the SBP is normal, but the diastolic is not yet normal. The patient is rebounding from the hypovolemic shock. So the nurse should request a new IV norepinephrine. The treatment has to continue. The patient's respiratory rate and SpO2 are back to normal, so it is appropriate to switch from oxygen mask to nasal cannula. Postponing giving IV antibiotics is good because there is nothing in the question suggesting infection. Questioning the prescription of IV fluids from 0.9% to 0.545 normal saline is appropriate as the patient needs an isotonic solution, not a hypotonic solution. And that concludes the 44 UWorld questions from the days before the new generation NCLEX. Thank you for watching. I hope it has been of benefit to you. Thank you.